Venture into the frontiers of healthcare data innovation with the Health Data Forum. Welcome to the Health Data Forum's YouTube channel, your gateway to thought-provoking conversations, cutting-edge insights, and groundbreaking advancements in healthcare data. Join us as we explore the transformative power of data to revolutionize healthcare delivery, patient care, and societal well-being. Embark on a journey of discovery. Delve into healthcare data through our informative videos, featuring leading experts, thought leaders, and innovators. Discover how our global movement, data first, AI later, is building a strong foundation for ethical and impactful healthcare solutions. Experience our unique collaborative spirit. Be a part of our vibrant community of health data enthusiasts, where ideas converge, partnerships flourish, and innovation takes center stage. Participate in discussions, share your perspectives, and join us in shaping the future of data-driven healthcare. Stay informed about the latest developments in healthcare data through our comprehensive video library. Catch up on insightful interviews, thought-provoking presentations, and engaging discussions about the role of data as the backbone of healthcare transformation. Join us in shaping the future of healthcare. Let's harness the power of data to transform healthcare for the better. Subscribe to our channel today and become part of the Health Data Forum's mission and our Data First, AI Later initiative to make healthcare data work for everyone.
Commission as administrator for the pharmaceutical unit, the Directorate General of the Enterprise and Industry, and Executive Director of the Portuguese Pharmaceutical Industry Association. So I also has a perspective from both sides of the industry, and this is really what probably makes Recent an exceptional professional and a leader in this field. Of course, in addition to his professional life, he's also assistant professor of faculty in pharmacy of the Faculty of Pharmacy in Lisbon, where he coordinates the Master in Regulation and Evaluation of Medicines and Health Products. His contributions have been recognized in multiple awards like Almofaris Awards, European Correspondent Member, French Academy, and a Medal Distinguished Services Gold Degree for the Portuguese Ministry of Health. Dr. Rui Santos, thank you very much, and a round of applause. So I also would like to take advantage of this opportunity to introduce also the speakers already also in present. Dr. Saleem Sayani is a seasoned software development professional with over 15 years of industry experience. He currently serves as the Director of Engineering at Aga Khan Technology Department at Aga Khan University, where he leads development teams, oversees delivery of innovative technological solutions. Previously, he held leadership roles in distinctive companies, where he was also responsible for strategic digital transformation initiatives. And he holds a master's degrees in software engineering and is recognized for his ability to align business objectives and effective technical solutions. Dr. Saleem Sayani, round of applause, and please join the floor here. And last but not least, a dear friend, a person that I have the pleasure to collaborate in several instances, a politician, Pedro Ramos. Is born in Funchal as a medical surgeon at Dr. Mendoza Hospital. He served as director of the emergency department from 2009 to June 2010 as the clinical director of Madeira Regional Health Services. And he also led the Madeira Clinical Simulation Center. It was something that it was started by Dr. Pedro Ramos in the 2012, a very pioneering time. With extensive experience in emergency and trauma medicine, Pedro Ramos has been actively involved in training in regional, national, and international levels. He has a guest lecturer at University of Madeira, and he has held leadership roles, including coordination of the trauma chapter of the Portuguese Society of Surgery and vice chair of the military and disaster sections of the European Society of Trauma and Emergency Surgery. An international instructor, Pedro Ramos began his political career as Regional Secretary for Health in December 2016. He has since served as a Regional Secretary for Health and Civil Protection in Madeira's 22nd and 23rd and 24th regional governments. Dr. Pedro Ramos, thank you so much for joining us. A round of applause, please. Dr. Rui Ivo, now the floor is all yours to conduct the session, and I hope you enjoyed this opening session day 2.
Thank you, Dr. Paulo Abreu. Thank you, Paul. Thank you for the introduction. Thank you for the invitation, and thank you for allowing me to share also this morning with you. It's a pleasure for me, of course, to be here with all those that are in this event, this important event, both here and also online. So I would like, of course, also to greet Dr. Saleem Sayani, that is one of the keynote speakers to whom I will give the floor in a few minutes, and also Dr. Pedro Ramos, who is with us, but in his native region. So I'm also, Dr. Pedro Ramos, abraço aqui de Lisboa. Thank you also for being with us. So we have this session that is focused on the future of health technology assessment. And I believe that we have, Paul, I have here the note that we have two welcome remarks first, right or not? So we go, okay. So we go directly to the keynote addresses. So without any further introductions, I think I would ask Dr. Saleem Sayani to take the floor, please.
Good morning. Good morning. Yeah, that's like it. Okay. So now it feels that you all had some coffee. Okay, great. So thank you for the introduction, and thank you, Paul, for the invitation. Before I share my experience, so the whole idea in next 20 minutes, what I'll try to do, I'll try to take you on a journey to Asia and Africa. So just buckle up and be ready, because you will have an amazing tour to one of the countries in Asia and one of the countries in Africa. So the goal here today is to talk about real world evidence, how technology transformation has happened in LMICs, low and middle income countries. And particularly, we'll be talking about two countries, Pakistan in Asia and Kenya in Africa. So we'll go through that, and then I'll share my experiences, my learnings, and what we have done. There are some challenges, how we mitigated those challenges, and how those challenges are generalizable to the global population. So what we learned through our journey is that, whenever you think about any digital transformation, it is all about data. It starts with data, because if you have good data, it means that you have a good foundation. And once you have good foundation, it means that you will have a good journey. You can build a good building on it. And as we heard yesterday, that, well, you need to have a good foundation so that you can build good building on it. So in terms of data, what we found is that there are certain elements in data that you need to consider in terms of having a good foundation. One is accuracy, accountability of that data, transparency of that data, and also the quality of that data that provides a good foundation. And we'll talk about briefly about these before we get into our story of our experiences. So as we all know that any AI model, there's so much hype about AI, right? So any AI model will be trained on the data that you provide. So it all depends on the data, that what type of data you're providing it to be trained on. If you provide heterogeneous data, it will have a good model for you. If you provide homogeneous data, then it may not be generalizable to the bigger population. So we need to think about that what type of data we are providing to these algorithms, so that they are predicting something that we want to be predicted. Of course, it goes without saying that if you have biased data, then the result will be biased, right? You will have inaccurate predictions. You will have some sort of discrimination in the prediction. So we got to make sure that we think about data accuracy when we talk about digital transformation. Now, something that is really important is accountability. So when it comes to data, we got to make sure that there is an accountability system in place, right? And there are three elements to accountability that we learned. One is, where is this data coming from? How this data is being collected, right? What is the process? We need to understand that process, and we got to make sure that that is a streamlined process, and there is accountability in it, and there is a check in it, right? Now, also, who's responsible for the quality of data? That is also important. We got to make sure that data quality is managed and ensured properly throughout this process. Now, at the end, who will maintain this data and how this data will be maintained, right? So that is also very important. And this is where, if you have this entire process taken care of, then what it means is that you are creating trust, public trust in your data, your technology trust in your data, your AI trust in your data, right? That is very important. Now, again, one element that is really very important is transparency. And this is where, again, the trust factor comes in. If your process is transparent on how you're collecting this data, how it is utilized, and how it is processed, so it will create trust of your users and your technology, both. And this will result in gaining confidence. And when it comes to regulatory approval of AI, this plays a very critical role, right? And we all know, we heard this yesterday, and that anything that we do, we got to make sure that foundation is sound. So if your foundation, your data is sound, it is heterogeneous, as we said, it pays off, because then you can generalize. The whole idea is data collection and prediction is what? So that we can generalize it, right? So we can apply that to different situations with a higher level of confidence. So that is the idea, right? And investing in the infrastructure and investing in the data is the key, because it pays in long run. Sometimes as a policymaker or as a business owner, you would think, oh, really, do I really need to make this investment here? This is a humongous investment to start with. But I argue that we should do that. We should calculate it. Of course, you make a business case and all that, but we have to invest in data, which is the foundation of your digital transformation. If you don't do that, then you're building a building on a foundation that is not that strong, right? So, this is what we learned through our journey, that your proactive bias mitigation, that is very important, that you got to make sure that you prioritize your data quality that we talked about, so that there's no bias or minimum bias, and your confidence interval in your information, in your data is higher, right? So that is very important. And if you do that, what we found that you create a fairer AI system. What it means is that it is an equitable AI system that is being developed based on the data, the quality of data that you had. So that is very important for us. And then any AI that you develop should be socially responsible, we found. And the way that it can happen is that it will have positive impact. If you have good quality of data, you have equitable AI system, then you have social impact on the society. Now, let's go to Kenya. So this is Aga Khan University Hospital in Kenya that we have. It is a tertiary care hospital with multiple primary and secondary care health settings. And what we learned that throughout our system, we have so many data touch points that we need to integrate. So we integrated an EHR that takes care of acute, ambulatory, home healthcare, long-term care, patient portal and telehealth and behavioral health, all that with one single data source, so that the source of truth is one, which we have quality control on. And then if you can see on the right, it has all those features that as a clinician you would want to see, as a patient you would want to see. And the bottom line is that it provides a robust clinical decision support system with a focus on beneficiary outcome. So beneficiary focused outcome is really very important, because who's your beneficiary? In this case, our beneficiary is patient, our beneficiary is a provider as well, right? Now, so, having data is one thing, but having a different view of that data is something very different. Sometimes you may have a state-of-the-art data system. You may have good information in your EHR or data system, but you may not have a specific view of that data for a particular segment, right? So what do I mean by that? So in a health system, you typically will have three segments of your audience. One is your provider, one is your patient, and one is your healthcare administrator, right? It could be more than that, but these are three typical common segments. So having data in your EHR, but having a different view for each of the segment is very important, right? And this is what we found that we could do with the integrated EHR system, that you can have a customized view of the information that you already have in the system, right? And then it is comprehensive. It is one-stop shop for all this patient data that you have. And that provides good prediction for physicians as well as for patients and healthcare administrator to assign resources where those resources are needed. Now, again, so this is a good example of 5 pillars that we have in our health record systems. That is, it is usable. Its usability is such that it is designed by clinicians for clinicians. So the providers, they understand the language, they understand how it should feel and look like. Its mobility, it is accessible anywhere in the world, wherever you have internet connectivity. It is flexible, speed, it's online connection, and then you have information when you need it and then where you need it. So it is one-stop shop for all your health-related data, whether you're a patient, whether you're a provider, or whether you are a healthcare administrator. Again, so through this implementation, what we try to do in Nairobi is that we try to move away from reactive mode to proactive and then predictive mode for our clinicians and for our patients as well. So this is very important, this journey from reactive to proactive to predictive mode. That is the essence of our digital transformation journey. And these are different views that you can see in the system. So as I said earlier, each segment will have a different view they would want to see. So there's a separate view for your provider, separate view for your healthcare administrator, and a separate view for your patient that we found is very helpful for us to have. And these are some views of screens of information, how information is projected through this EHR, so that you have data and then it is projected in different ways. And what it means is that you have actionable data that you can take action against. So that is very important, that it is okay for you to have data, but that data is no good if you cannot take any action against it. So this data will tell you what actions do you need to take. You have virtual queuing, so you can see how many patients are waiting in line to be seen by a doctor, right? So then if there is a long line in one clinic versus other clinic, then you can assign your resources accordingly, right? So as a healthcare administrator, this is very important for you. As a patient, it is very important for you. You see that, well, okay, what is my wait time? My wait time is 2 minutes or 10 minutes or half an hour, right? So based on that, I can plan. So information that is actionable, that is the key of all this data systems that we have. And this is just an example of a full journey of medication ordering, right? So computerized physician ordering entry, CPOE. So this is where you see on the top, a physician is ordering a medication, that order goes for verification, it is verified, it is dispensed. After dispensing, it is being delivered and then administered. And before administering, the nurse verifies this information that, well, are you the same patient that this medication is prescribed to, that are being administered to as well, right? So this entire, from order to dispense, to verification, to dispensing, and to administration, there is this entire process, there is this data cycle that happens, and then this is recorded, and then it can be audited at any time so that you reduce the chances of error. This is, again, a visual of a command center of your health record monitoring. So you see all these screens and multiple different types of data is being monitored on different screens in a setup. So that is ideal. Sometimes it may not be possible for some of the health systems to have that because of the fact that it may require a lot of resources. So it is not mandatory that you should have this, but you have all this information in your system if you have a good EHR, and then it is up to you how you want to project it. Now, so that was about Nairobi. This is what we did in Nairobi, and this EHR we implemented in Nairobi that is almost a year and a half right now, and it is working fine. Now we are expanding to Tanzania and Dar es Salaam, and then we'll be scaling up the same system in Karachi in Pakistan. So we are on a journey of digital transformation, starting from Nairobi to Dar es Salaam to Karachi. Now, going to Pakistan. So how many of you, by the raise of your hand, have you been to Pakistan? Have you heard of Pakistan? Okay, all right, better, okay, better. So Pakistan is a country in South Asia, and it has 4 provinces, right? And one of the provinces is Khyber Pakhtunkhwa, that is KPK. So there was a challenge that government of Pakistan, Khyber Pakhtunkhwa government came to Aga Khan University saying that we have a problem that we have this immunization program for children. We immunize children, and our vaccinators, they go out, they immunize, but it is all paper-based system. And the challenge is that we have 2 programs, lady health worker programs. These are the frontline health workers. They go in the field and they do deliveries, in-house deliveries, right? So they are the people who know that a child is being born wherever and whenever that the child is being born. But the challenge is that a vaccinator who is assigned to vaccinate that child doesn't know that after some time. So there are chances that a child missed the critical vaccination dose that should be administered at birth. So how can you help? So what we did is we designed an application for them, a data application that was to integrate their LHW program, Lady Health Worker program, with their immunization program. So just imagine, these are 2 vertical programs. They are working in their own silos. One program doesn't know what other program is doing, even though their work is integrated, right? Their work, there is a lot of dependency in their work. So we created this system for them. This was funded by Grand Challenges Canada, and they liked this idea very much, and they funded it. So it was funded through Grand Challenges Canada and Aga Khan Foundation Canada and Government of Pakistan to have this program. And now through this program, what is happening is that there is vertical integration as well as horizontal integration in these two programs, because there's so much dependency in these two workforces, right? So these two programs are interconnected. Now, whenever a child is born in any of the villages in Pakistan, in Khyber Pakhtunkhwa, a lady health worker will integrate this information into a mobile application. And then vaccinator would know at the same time that, well, this child has been born here and I need to go and vaccinate. So now there is seamless integration. It was implemented in just one district. Now, with the success of this project, we have been asked to roll it out for the entire KPK district and then later on in other districts in other provinces of Pakistan. So this is just to give you an idea that how digital transformation can change lives for health workers. Now these health workers, before this application, they had to carry two bulky registers whenever they went to any village. And so since you don't know the terrain of Pakistan, it is mountainous areas, and it is weather conditions are so bad sometimes that there are some areas where you actually don't have any access in 3 months out of 12, right? So you cannot just reach those villages because roads are closed. There is the feet of mountain on the road. So that doesn't mean that people don't get sick. People do get sick. They do need healthcare, right? So how do you address that? So using technology in those type of low resource setting means difference of life and death as compared to convenience in other parts of the world, right? So that is very important. And that is the message that I want to convey, that technology is impactful. It is very meaningful if it is used right. And we have good examples of using this technology and saving lives. Thank you so much.
Thank you very much, Dr. Saleem Sayani, for your very important presentation and for highlighting, say, the principles and the fundamentals, and also for showing us a lot of application and very important examples. I think we will have the chance to have some questions at the end, but probably what I will do is I will give the floor to Dr. Pedro Ramos. Dr. Pedro Ramos.
Como está, doutor Ivo? Tudo bem?
Está-nos a ouvir?
Estou a ouvir bem. E vocês estão a ouvir bem?
Muito bem. Muito bem, não sei se um bocadinho, mas eu penso que o som depois é controlado daqui. Dr. Pedro Ramos, tem a palavra. The floor is yours. Thank you very much.
Thank you, Dr. Ivo. Good morning, everyone. It's a real pleasure being here for the Health Data Forum Global Hybrid Summit. Thank you for the invitation, Paul Nunes, and the organization of this meeting. And I would like to give special greetings to the chair of this audience, my friend Dr. Rego, president of INFARMED, National Authority for Medicines and Health Products, and to my panel colleague, Saleem Sayani, director of Technology Innovation Support Center of Abakan University. And of course, thank you to the audience for being here. HTA is a multidisciplinary process that involves properties, effects, and impact in the healthcare system, and it is very important in decision-making. Technology and digital transformation will be part of the future of the healthcare system, with strong influence on the assess, the approach, the diagnose, the treatment, and recovery. And also consistency with the evolution, it will develop an important role on health economics, outcome research, evidence-based medicine, medical ethics, medical sociology, and health service research. How can it be helped, the HTA? We need to define a model to develop a working definition of patient-based HTA, to identify the current barriers to adopting a patient-based model, and to formulate a vision of how a patient-based HTA could be used to promote patient empowerment and patient-centered care. In the ideal setting, a patient-based HTA would promote patient knowledge by providing access to information and promoting an informed dialogue between patients and their healthcare professionals. To implement a patient-based HTA, the focus must turn to the patient's issues and incorporate each patient's unique perspective and preferences. Process must change to increase patient participation in all levels of health technology assessment and aim to promote empowered patients who can make informed decisions. In the present day, HTA is broad and I may say large and has numerous stakeholders with none so important as the patient. By asking patient-oriented questions in HTA and better involvement patients throughout the entire process, we can easily promote patient empowerment and make patients more capable to play a more active role in healthcare decision-making. The past 25 years have been accompanied by more advances in medicine and technology than at any point in human history. At the same time, the evaluation of novel medicines and technology behind registration issues related to safety and efficacy has become a core component in the process that includes the healthcare professionals, the providers, and the payers. We need to understand the future. What are the trends for the next 50 years? What are the challenges? Which scenarios we will have in the world, in Europe, in Portugal, in my island? How HTA can improve sustainability of the system? What kind of patient we will have? But most important, what kind of doctor we will need? We need to speak how this revolution has been made since the 18th century. Using industrial revolution to cross history, we are facing the fifth revolution nowadays. The first one started in England with the beginning of the machines. We call it mechanization in the 18th century. The second one appears with the technology in the late 19th century and beginning of the 20th century with mass production. We call it electrification. The third one appears with electronic carrier computers and we call it automation in the 20th century. The fourth one is characterized by the IoT, the automation, data. We can improve efficiency and process. We call it digitalization. And finally, the fifth revolution with robots, smart machines, working with people in virtual reality, mixed reality, AI, and we call it personalization. One thing that we know is that HTA is ongoing. The future is now. The other thing is in what terms this is happening. Like Steve Jobs says, the key of success is knowing what is the direction of the world and try to arrive at first. The Moore law says that the capacity and development of technology double each 2 years. So we need to know how will be the world in the next years. We choose 6 axes: the geopolitics with instability, European and worldwide, the environment with climatic alterations, improving asymmetries in the population, the technology with hyperconnectivity, AI, data science, society with the appearance of new societies running by technology, demography with more older people, more vulnerability and more literacy, and economy with digital transformation, innovation, and telehealth. We are building a new world with connectivity, with AI being the model of transformation that could bring some tensions in society and can cause asymmetries between countries. AI and quantum computation will be the key of the disruption that will permit to solve problems that will be impossible by the traditional computer nowadays. We just finished to pass a pandemic situation during 3 long years. We can say probably there is no health system in the world prepared to face 19 COVID, but technology helped us to develop chains of surveillance supported by data. If we compare the industrial revolution with the health revolution at the same time, surgery is one of the specialties who changed a lot. The first era, it was the beginning of the knowledge of anatomy and the surgical instruments. The second one, the development of anesthesia and surgical procedures. The third one, the robotic and endoscopic surgery. And the last one with the AI, the 5G, with the connectivity. In the future, we will have less invasive surgery, robotic, ambulatory, special training on a simulation model. Madeira already started this new direction with our clinical simulation center since 2012, with more than 700 courses, 11,000 students, and 7,000 hours of education program. Universities and hospitals need to be prepared to still continue to have an important role on the education programs of the doctors and other health professionals, where investigation, innovation, and digital transformation must be urgently added to their curriculum. Immersive education throughout virtual reality and augmented reality can allow to reach a personal education where real practice will be substituted by virtual practice in a simulation environment, and so we can assure more quickly and more rapidly medical and health education. This technological jump with the advance of genetics will permit in the future the personalized medicine, the medicine of precision. Computational science, computational medicine, and genetics will be the pillars of the new medicine, where the development of interface between man and machine will be important in the future, improving the relationship between biologic, electronic, and quantum computation. AI is going to change health and healthcare system. They don't substitute doctors, but in the future, doctors who use AI are going to substitute those who not use it. The future will be with age technological assessment, and they will improve sustainability with value-based healthcare and literacy. We will have new proposed patient-centered leadership, skill mix and task shifting, digital health, home care, daycare treatment, robotization, data center and data science and analytics, clinical pathways. So the future will have 4 trends: automation, augmented reality, data science, and quantum computation. With this new reality, who is the future doctor? With what skills they need to have? We create a hub innovation to help to promote healthcare system in Madeira. We are related with several institutes and universities, national and international, like Nova University. Investigation and innovation are in our plan to 2030 of digital transformation. 3 axes for us are very important: improve healthcare conditions of work, improve healthcare satisfaction, improve management of the healthcare system with more efficiency. We are focused in Madeira on mobility, interoperability, people-centered service with value-based healthcare, creation of a knowledge center, a new knowledge center with quality and security and with technological evolution. Madeira government also other projects with Innova like Smart Bear, Smart for Health, ICU for COVID, quality chain, that has the objective to improve digital transformation on our health system with the creation of new service supported by innovations, digital solutions. We also have several programs with our informatics system: SIMA screening, upgrade of immunology, app to Cesar for the citizen, to the management of occupational health, for the temporary incapacity certificates, for the social file of the patient, for the Manchester triage, telehealth in primary care, patient portal, IntelliView Guardian from Philips with internal patients with the early warning signs, app for management transportation of non-urgent patients. The new hospital will be a Kiwi hospital with knowledge goal. Hospitals will need to increasingly operate and require the highest degrees of science and technologies, from the simplest one to complex genomics and other omics. Intelligent, using the artificial intelligence in basic medicine procedures like Da Vinci robot, imaging or genetics, for example. Wise, only people can be wise. Wisdom is still a human prerogative, yet trust and ethics are very important. Trust and digital ethics, reinforcing structures and process, will need to become their core competence, as technical and scientific potential to do harm or bad is immensely increasing. Interoperability, a term often associated with information technology, while IT interoperability standards use and big data space for exploiting the value of secondary and tertiary data. So the fundamental for us are hospital at home, interoperability, robotic. Madeira has one direction, health development in Macaronesia region. One compromise, health for everyone, everywhere, every moment in Macaronesia. One objective, health and well-being in every age for all. To finalize, we are convinced that HTA will have strong impact in the healthcare system in the future, giving us a possibility to have a more efficient system, a more sustainable system, reducing the pressure of our system with more security, with more quality, but also a more precision system. That's our thinking, because we have the responsibility to leave society better than we found it. Thank you all for your attention.
Thank you very much, Dr. Pedro Ramos, for your keynote. You give us a different angle also from your position as regional secretary of the government of Madeira. So also highlighting the importance of the utilization of this technology that we have. I think we have some time for perhaps I move again to the no, but then I don't see Dr. Pedro Ramos. I think we have some time for some questions. I think we had here two very important presentations, and from two different perspectives. Dr. Saleem Sayani has very much highlighted also what I call the principles and fundamentals of how we can use this gold material that we have, all the data, and how then this can be applied in specific cases that he showed to us. And Dr. Pedro Ramos also expressed also the potentials of all these changes. So also in terms of the empowerment of patients, in terms of the efficiency of the system, in terms of sustainability, and also what he's doing. So I think we are living probably, yesterday at the dinner we were talking about that this is probably similar to what happened in the early 90s with the internet. So probably is what we are. But it's very important that we look into these different aspects, because if I look from my angle of activity as a regulator, of course, we see here lots of potential on all these developments, but we also have to be very conscious that when we are taking decisions, we have a very solid basis for taking such decisions. So some of the points that Dr. Saleem has made are very important. So I'm trying to just highlight some aspects and allow for perhaps one or two questions. We have some minutes. I don't know, Paula, if there are also from outside.
Yes, Rui, if there are some questions from Zoom, please let me know. And then there questions here. Okay.
Yeah, there is one here. Yes, please.
Please introduce yourself so we know who is speaking. Thank you.
I'm Lisbeth Sideris from Netherlands. I'm a pediatrician, and I'm also a patient representative of rare diseases. And I hear three things: mother and child healthcare in Pakistan, where the connection should be from pregnancy to childbirth. Yeah, it's working. And genetics. So, and I've been in India many times, Sri Lanka many times, so I know how the systems are there. And we collaborate as European pediatricians with the world pediatricians. So there we are advocating for one child health dossier, one interoperable child health dossier. And we can follow the WHO guidelines on primary child health care, including also pregnancy. And how can we do that? By using collective data, harmonized data in HL7, FHIR, and different data. And that is not, to be honest, very difficult. It's not very difficult. It seems all difficult, but it's not. Just make a guideline, digitalize it, and make it interoperable. It can be with real rural areas. And in Europe, we also have low economy, Moldavia, very bad situation there. So there I've been also to reach out to rural areas. That is important, exactly as you say. And that will make a big difference. it's not only the big hospitals, it should be reached out everywhere in the world, especially children with rare condition. So do you have experience with HL7? Is your system applicable with HL7 and codings like the WHO, ICD, or ICF? That's my question.
Thank you.
Thank you.
Dr. Sayani.
So thank you. Very good question. So I think the key is this is a perception which is, to me, it is a wrong perception that we should have one system. I think we should have a system that integrates with every other system. So to me, it seems like there is a layer that is integration layer that all different type of system they can connect to, but you raise a very good point that it should follow a standard for it to work. So for example, HL7. So HL7, we follow the example that I used in Pakistan. So we follow HL7 for interoperability, right? So that system can talk to each other, and any vendor in future, if they want to add a module to the system, then they know what standard to follow, right? So that is very important. And in low and middle income countries, as much as in high income countries, there will never be one system that will be a silver bullet for us. It would be multiple different systems at different levels. But the key is, if we have adherence to a certain protocol, certain standards, then we can make sure that at the end of the day, there is one dashboard. As a healthcare administrator, you will be able to see data coming in from 10 different systems and showing on one system, one portal to see, okay, this is what it means. I don't have to go to 10 different portals to get information to make a decision. So you will have actionable information at your fingertips when you need it and when you need to make that decision. At the same time, it is very important for patients as well, so that they can go to 10 different providers, but they will have one single portal where they can have all that information on their fingertips. So that is what we are trying to do in Pakistan and in Kenya and in Tanzania and in Afghanistan, Tajikistan, all these countries where we work. Slowly and gradually we'll get there. We have just started this journey, but the key point that you raise is so crucial that people need to understand is that whatever system we have, we must follow a standard so that it is interoperable.
Thank you, Dr. Sayani.
We have here a question from the audience, from the online.
There is a question from online. Okay. Please, so that's hear the question.
Okay, so the question is, what could be the impact of aligning Portuguese hospitals to move to use a unique system in health? This is by Philomena Santos from IQVIA.
Dr. Pedro Ramos, do you wish to make a comment on that?
Yes, Dr. Rui. I think it is an important question.
Very important, yes.
To use and aligning the Portuguese hospital with a unique system in health. We know that there is some difficulties to integrate the data for the several programs that belongs to the national health system. Here in Madeira, we are trying to reach until the end of the year the electronic health record for the public system, private system, conventional system, and social system, because we think is one of the measures that we can improve our sustainability of the healthcare system. I think this is a very important question and allowed us and everyone to think why we cannot change for a better outcome.
Thank you. And probably I will also add that we have some competitive advantage by having not a complete national system, because we need to connect Madeira and Azores, but it's very well coordinated. So this could play as an advantage for that purpose that Dr. Pedro Ramos was highlighting. I don't know if we have more questions from the audience.
Yes, one more question here.
Okay, please.
Please state your name so that everybody can know who is addressing. Thank you so much.
So this is Arma from the Health Authority. So my question is to the Saleem. You stress on the fact of the importance of data quality to gain the trust on data. So, but we see today that there is a lack of standardized approach of assessing data quality, especially in healthcare. We don't see like a de facto standard. So how we are going to get into this, like having kind of like a digital maturity that doesn't look into fields whether they're empty or not, but also to look into the day of life, making sure that if we have an HL7 message for a representing a patient coming to the hospital, then making sure that all the steps are followed up until they got discharged, for example.
Roxana.
Yeah, so equality is an equity in healthcare is very critical for us and in our network where we operate in countries where we operate. And we want to make sure that equity is at more than one level. So when it comes to service delivery, there's equity. When it comes to decision making, there is equity. And this is where data is so important for us to ensure that there is no bias in the data so that the model that we develop through that data is more equitable and more generalizable. So that is very important. That is what we try to do. And that goes beyond that just data, that is for service delivery as well. So if any patient, for example, comes to get service, irrespective of that patient's financial ability to pay, we provide that service, and there's component of patient welfare that we provide some subsidy to that patient. So it works on different levels.
Thank you, Dr. Sayani. Perhaps I think we are more or less on time.
Ainda não
for
sou especialista,
Ah,
é uma pessoa respeitada, tem os alunos da faculdade, pronto. E apesar de tudo, eu acho que ele sentiu que tem ali algumas oportunidades de crescimento, pronto. E ele pôs isso em perspectiva. E a
Is
partir
this
do
the
momento em que ele
question?
decidiu,
Rui,
agora
no.
vou ficar
I think
aqui,
we have someone from
cerrou as
Zoom.
fileiras no outro sentido. E
Okay.
foi assim um
Sorry.
bocado ambivalente.
No, it was not a question.
More
Eu-
questions?
Is there
in the
any
Eu
more
fiquei
questions?
quase a
There
atitude
one more
interpessoal
question
também
there?
is
mudou.
one, yeah.
Tipo, a facilidade de tomar um café, qualquer coisa parece que
It's good
mudou.
for me
Pá,
to
e depois
do this
as
job
pessoas
in the morning.
para mim, o
Thank you,
Ricardo estava
Chantal.
de igual para
Please,
igual, como
state your
especialista,
name
mesmo para
because
ser um bocado mais alheio, não sei o quê. Mas
online
também
Zoom
não
don't
é
know
desse
who is
gosto
speaking.
do Ricardo andar a controlar
I'm
o que é que
Chantal
ele estava a
Speakers.
fazer.
I work in the Netherlands for health research
Tipo,
infrastructure.
uma vez que eu
Thank you
estava,
very much,
eu à quarta-feira tinha consulta de
Dr.
luz
Saleem Sayani,
e ao
for your
mesmo tempo tinha a
presentation.
enfermaria.
I had a question
E
on,
houve uma
do you also, for the infrastructure that you just presented, have features for secondary use of the data that are in the, that are applicable maybe for research purposes? So an external researcher, say from a research institute in Pakistan, would want to have access. Do you have features for that data journey and that research journey already in place?
Yes, so thank you for the question. This is very good question, and this was one of the reasons why we implemented this comprehensive EHR, so that, of course, patient care is one very critical area, but equally important is how this data that we collect can be used for research purposes, so that we can learn from trends and be proactive and predict future trends and outcomes. So yes, we have this data set available. We have been working with some universities in US and in Canada to do some research on this data set. If you are interested, then we can certainly talk about that. There is a process that you have to go through to get access to this data. But data is available, yes.
Thank you, thank you. Is there another one, please?
Good morning, everyone. Tiago Taveira. I'd like to ask one question to both Dr. Saleem and Dr. Pedro Ramos, which is about how do you see this data and all the capabilities you've been describing can be leveraged by the healthcare professionals themselves to transform healthcare in your institutions. So I understand in both contexts, there are big opportunities lying ahead. And I would like to know your take on that. How do you see the health professionals benefiting from using these opportunities and tools that you are creating? Thank you.
Thank you very much for this question. Probably I will use it because I think it's a good opportunity also to ask you if you want to make a kind of final message by using the question that Dr. Tiago Taveira has made. Dr. Pedro Ramos, please.
Tiago, bom dia. Good morning, Tiago. It's a very nice question, and we have talked a lot in the last months about the importance of health data for our institutions, for our hospitals, for the primary care, for the continued care, for the palliative care. And as you know, what I said is that with data, we can have, with more information, we can have better decisions. And with the data and with the dashboards that reunion all the information to the health professionals, we can have time to humanization, to create another relation with our patients, with more humanity, and with more time for the spending for approach and for treat and for recovery. I think that it's not only doctors. The AI is going to be an extraordinary tool for the doctors and all the health professionals. And the doctors that are using AI are going to substitute, as I said in my presentation, the doctors that they're not using today. So I think it's the future, the data, and we need, as I said in my presentation also, we need to add to the curriculum of the health professionals all of these new issues about data science, data analytics, AI, augmented reality, virtual reality, to understand more how is the future in the healthcare system, where we are going to have robots and professionals, human professionals, working together for a better outcome.
Muito obrigado. Thank you, Dr. Pedro Ramos. Dr. Sayani?
Yeah, just to add to what just being said, we are just scratching the surface right now, as you know. So I give you just one example of Aachen University, how we are doing this. We are using all this data to learn from it, and we are using this in our education of our medical students and nursing students as well. So if you, and then my invitation to you to come to Karachi, as we have talked about earlier. So when you do come there, I'll be very happy to take you to our lab, our continuing medical education lab, which is an innovative space where we use AI, we use augmented reality, we use virtual reality, and all other simulation to actually provide education and prepare future doctors and future nurses in a very simulated environment.
Thank you, Dr. Sayani. So, Dr. Taveira Gomes, you have a trip now planned to Karachi in Pakistan. So I think we can close the session. I would like to thank very much both Dr. Saleem Sayani and Dr. Pedro Ramos. It was a pleasure for me being here in this session. I think you both highlighted, I would say, the opportunities and the challenges that we have in a very concrete way. Also showing that this is not something that is not existing. We are just living, so we have to work also very much together to find the solutions. There's a lot of things ongoing. The next session will also show that. So I think this was a very good session to start this morning. So thank you again, both. And I think now we go for the break and we'll reconvene around 11 o'clock. Thank you very much and have a very good day. Thank you.
Thank you, Dr. Rego. Thank you very much. Thank you, Dr. Saleem. Thank you.
ago, the world was different than it is today. Our ability to network, to collaborate across borders, the ease of collaboration across borders is way faster, way easier. We want to actually change in order to enable greater collaboration. The specific thing that, and forgive me for the term, because it's not an English word, it's one that I made up, but I call it co-opetition. So we need to define what are the policies that allow for cooperation across borders, and that cooperation across borders means that our policies within countries need to be compatible with other countries.